Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through August 11th, 2022. This week, I'm going to do a quick update on the monkeypox outbreak because there's been some news this week, but then I want to talk about an article that I just saw this week about the impact that climate change can have on infectious diseases. If you think about it, in the last month or so, we've talked about climate change, but over the months, we've talked about monkeypox and COVID and other infectious diseases. So the question is there a relationship between the two? In terms of the monkeypox outbreak, I think you all know that the Department of Health and Human Services has declared a public health emergency in the United States. This goes on the heels of the WHO declaring it a public health emergency of international concern. So where are we? We've got about 32,000 cases worldwide in 89 countries, the vast majority of which are in countries that have not historically had monkeypox. According to the PAHO, 98.5% of the cases are male with a median age of 36. Again, the blue dots are the countries that have historically had monkeypox. The orange dots are countries that have not. The size of the dot reflects how many cases there have been. And if you look at this, you can see that the United States leads the pack, followed largely by European countries with a little bit in the Americas and some in Africa as well. If you look at the date of onset of symptoms, what you can see in blue is the Americas, all the American countries, largely the United States, and red is Europe. And what you can see is that the number of cases in Europe seems to be slowing down while the number of cases in the United States and the rest of the Americas is going up. Ignore that last column on the right because that's only partial data. Even more worrisome, if you look at data from PAHO, the Pan American Health Organization, the blue bars are the United States, and you can see our number of cases has been going up pretty consistently and pretty rapidly. But look at all the other countries combined. They seem to have peaked in early July and then been coming down. So this is a disease right now that is largely affecting the United States, perhaps more so than in Europe and more so than in the rest of the Americas. In the States now, we've had 9,492 confirmed cases, almost a third of all the reported cases worldwide. Every state in the United States has had a case except Wyoming. And if you look at the numbers of cases, you can see from New York with over 2,000 down to Minnesota at 55. And the numbers keep going down. I just couldn't put them all on the screen. This points out, though, and especially for the students, this points out one of my frustrations with data. This is raw numbers of cases, but it doesn't tell you the rate. So I calculated the rate for the first 15 states, and you can see a pretty significant difference. Instead of California being at number 2, it's down at number 7 or 8. And so whenever we see raw numbers, we have to ask ourselves what this means in terms of rate. And you can see that there are a lot of states where the rate is pretty similar, but of course, New York is still well above everyone else. So an evolving pandemic, perhaps slowing down in other countries, but not yet slowing down in the United States. I haven't seen the weekly update map from the CDC this week. I'll let you know what I see in that next week. But I want to talk a little bit about this interesting article that came out in Nature Climate Change. And what they did is they looked at all pathogenic diseases. Pathogenic means it causes disease. All pathogenic diseases that can be aggravated by climate change. And what they have a nice review of sort of all of the impacts of climate change. You have greenhouse gases cause warming. It changes natural cover. It impacts the climate in the ocean, causes storms, sea level rise, precipitation, floods, drought, heat waves, fires. All of these things can impact infectious diseases in humans. Right? And so the article says, while numerous biological, ecological, environmental, and social factors contribute to the successful emergence of a human pathogenic disease, at its most basic level, it depends on a pathogen, thing that causes the disease, and the person coming into contact, and the extent to which the person is weakened or the pathogen is strengthened by the climatic hazard. So, for example, climatic hazards can bring pathogens closer to people. So, for example, as things warm up, insects, particularly mosquitoes, can go into higher altitudes because they typically don't go above a certain altitude. And of course, floods cause wastewater overflow, so more people are exposed to infectious organisms. It can also bring people closer to pathogens. Heat waves will cause people to use recreational water use, or human displacement. People who normally lived on the coast will move inland and so on. Pathogens can be strengthened by climatic hazards. Warming can increase mosquito replication. Ocean warming can go to algal blooms and so on. And then people, of course, can be impaired by climate change. Obviously, flooding, wildfires, a whole bunch of things can impact agriculture. And on a large level, that can lead to malnutrition. People who are relatively malnourished are weakened when it comes to protecting themselves against infectious diseases. And of course, something as simple as a drought can cause people to drink unsafe drinking water. So there are a lot of ways in which climate change can increase exposure. The article, interestingly, points out that almost a quarter of diseases studied could be diminished by climate hazards. In other words, made less serious to humans. But in some cases, it really depends on the climate hazard. They have this interesting diagram that shows that the vast majority, 78% of diseases, are all made worse by climate hazards. There's about a fifth that can be worse or better, depending on which hazard it is. So for example, flooding could destroy mosquito breeding, so that it reduces malaria, at least in the short term. And then there are some diseases that are exclusively made better by climate change. This diagram is really complicated, but I think it's really important to remind us that there are so many ways that the changing climate is going to impact our exposure to infectious diseases. And I think as we look at, we always tend to respond to the disease as it occurs. How do we treat this disease? How do we vaccinate against it? How do we change behavior to it? All of that's important, but we have to understand that underlying this, if we're going to keep seeing climate change, we're going to keep seeing an increase in the exposure and the vulnerability of humans to infectious diseases. So we've got to understand that climate change is a major public health threat, and we need to work together, as we have on other issues, to make sure that not only do we respond to these diseases when they occur, that we work together to try to prevent them. So monkeypox growing in the United States, perhaps slowing down in other places, we'll wait and see. And does climate change impact infectious diseases? Absolutely. If you know of anyone who'd like to be added to our mailing list, please let us know. Thanks as always to Derry Young for editing, producing, adding captions, and posting this video. And as I say every week, I really enjoy hearing from you. I get a few emails every week, sometimes more than others. And I try to respond to them either in a return email or in the next week's video update. I look forward to hearing from you. So until next week, please be well.